Welcome to Pharmacology by Lecturio. I'm Dr. Praveen Shukla. Today, we're going to talk about some anti-seizure and anti-epileptic medications. The principle behind anti-epileptic treatment is to ensure that we're going to be blocking the transmission of neurotransmitters into the synaptic cleft within the central nervous system. We have many ways of doing that. The first way to do that is by blocking sodium channels. Now you can see sodium channels are present in the terminal buton at the top of that diagram there. Sodium channel blockade is a rate-dependent process, and doing so gives us a prolonged refractory period. We have many medications that can cause a blockade of the sodium channel. The most commonly used is phenytoin, also called Dilantin. Now, other medications include carbamazepine, and we also have drugs like lamotrigine, which can block the sodium channel. Newer drugs have come out onto the market as well, and you can see them listed there. Those aren't as important for your exams, but certainly they are now going to be, I think, the standard of care going forward. The second way that we can affect epileptic activity in the brain is by acting on the GABA channel. Remember that benzodiazepines increase the frequency of opening of the GABA channel, allowing chloride to enter into the cell. Barbiturates also act on the GABA channel by increasing the duration of opening of that channel. Now here is the GABA receptor. This illustration clearly shows that benzodiazepines and barbiturates both act on this channel to help move chloride across the membrane. GABA potentiation can increase the activity of GABA as well. This isn't acting directly on the channel, but actually acting on the molecules. Topramate and valproic acid are two of these agents that can help potentiate the activity of GABA. There are other ways that we can affect how GABA acts in the synaptic cleft. So we can inhibit the reuptake of GABA from the synaptic cleft back into the terminal buton. Tiagabine is a drug that inhibits GAT1, which is the reuptake molecule. It prolongs the action of GABA by leaving it in the synaptic cleft. This results in less activity in the affected neuron by increasing chloride movement, and so the affected neuron is now unable to depolarize. Another way that we can affect the postsynaptic neuron is through calcium channel blockade. This is a rate-dependent phenomenon, so the more often that particular channel is firing, the more effective the treatment will be. This prolongs the refractory period of the target nerve. Ethosuximide is a T-channel or T-calcium channel effector. Valproic acid also works on a similar channel, and gabapentin acts on the alpha subunit of a reuptake molecule that picks up calcium. Pregabalin, or Lyrica, is an alpha subunit active agent, and although it's not as used as much in epilepsy, we do see it a lot in pain management. Another way that we can affect how effective the synaptic cleft is by potassium channel activation. You can see potassium channels up at the top of that slide. It is by activating the potassium channel, you cause membrane hyperpolarization, and once again, you're prolonging the effective refractory period of that particular nerve. So this particular drug, or these sets of drugs, will therefore cause membrane depolarization or prevent further repolarization of that membrane. Valproic acid may also be acting on potassium channels too, as well as its activity on calcium.